Now we are going to talk about antihypertensive medications. Firstly, it's ACE inhibitors, angiotensin converting enzyme inhibitors. They block the conversion of angiotensin 1 into angiotensin 2 and cause the vasodilation, that is the enalapril and lisinopril. They are also used as a first line drugs in diabetic and heart failure patients. They decrease the preload and afterload. They are contraindicated in pregnancy as well as bilateral renal artery stenosis. Their adverse effects are hypertension, hyperkalemia, dry cough, and angioedema. We have ARBs, which are the angiotensin receptor blockers. Their mechanism of action is directly blocking the angiotensin 2 receptors and they cause the vasodilation. Their adverse effect consists of hyperkalemia and hypertension, but they do not cause the dry cough. Next, we have calcium channel blockers. They block the L-type calcium channels and hence they reduce the contraction of smooth muscles of blood vessels. Further classified as dihydropyridines and non-dihydropyridines. The first one has following examples like amlodipine and nifedipine. They are used in hypertension because they cause the vasodilation, while the second ones are used to reduce the heart rate and contractility, and they have the examples like diltiazem and verapamil. Their adverse side effects are ankle edema, flushing, gingival hyperplasia, and headache. Is thiazide diuretics. They work by blocking the sodium and chlorine co-transporters in distal convoluted tubules, and then they reduce the sodium reabsorption, hence the plasma volume. Their adverse effects is hyperglycemia and hyperuricemia, while hypokalemia and hyponatremia, and they are also used in recurrent stone in kidneys because of reabsorption of calcium. Next, we have loop diuretics. They work by blocking the sodium, potassium, and chlorine co-transporters, and they act on the ascending thick loop of Henle. Their adverse effects are hypokalemia, metabolic alkalosis, as well as the ototoxicity, and they are useful in renal failure, in pulmonary edema, as well as heart failure. We are going to talk about the beta blockers. They block the beta adrenergic receptors and hence they reduce the contractility and heart rate. They are used in arrhythmias, heart failure, as well as the post MI, and their adverse effects are bradycardia, bronchospasm, and sexual dysfunction.